I'm cancer physical therapy expert, Dr. Leslie Waltke, and this is the Recovery Room, an educational platform for people diagnosed with cancer. Today, or tonight, we are talking about exercise. Now, before you hit the delete button, stop. You need to hear this. If you are a cancer patient or cancer survivor, exercise can directly impact the quality of your life and the length of your life. And research has even shown that exercise may decrease the risk of recurrence in some types of cancer, including breast, prostate, and colon. So whether you've been diagnosed with stage 1, stage 2, stage 3, or stage 4 disease, you will exercise like your life depends on it, because it does. Here are the stats. Exercise reduces cancer-specific mortality by up to 44%. Exercise reduces all-cause mortality, dying of other kinds of crap, by up to 48%. And exercise reduces cancer recurrence by up to 35%. Welcome to the Recovery Room, which this evening is the exercise room. Please don't roll your eyes or feel overwhelmed, because in the next couple of minutes, I'm going to give you a broad overview of how much you need to do and ways to maximize your success. In future videos, we'll get more into the nitty-gritty detail. But here's your overview. Whether you're in treatment or in survivorship, the American Cancer Society wants you doing light exercise about 150 minutes a week, which totals 2.5 hours, or 75 minutes a week of more moderate exercise. Some of it should be aerobic exercise that works your heart and lungs, and some of it should be weight exercise that strengthens your muscles. This exercise can include things like walking, cycling, dancing, or weightlifting, walking up and down the stairs, or doing push-ups against a wall. People, it doesn't have to be complicated, and it doesn't have to be expensive. To help ensure your success, number 1, pick something you enjoy and that is readily available. Number 2, start with super easy levels of exercise for you and build from there over the weeks. Number 3, set a goal for yourself, 4 to 6 weeks down the road, and keep yourself on track, like wanting to be able to walk or run a certain distance, or keep moving for a certain amount of time. And finally, my all-time favorite tip, get yourself what I call an ECHO, E-C-O, an exercise compliance officer. Get one or more people in your world who will keep you accountable by exercising with you and keeping you on track to reach your weekly minutes goal. If you know your friend Jose is expecting to exercise with you at 10 o'clock on Saturday morning, you are much less likely to back out. It's a win-win for both of you. Recent studies have shown that only about 20% of cancer doctors and nurses talk to their patients about exercise. But that doesn't mean they don't know it's incredibly important. They do know the benefits of exercise. So if you need help, please contact your cancer doctor, nurse, or physical therapist to help you get started. Whether you are old or young, fast or slow, or are flashy or rusty, there is no one on the planet more important than you. Think about that. You have one life and one body. Care for them both well. I'm Dr. Leslie Waltke, and you're in the Recovery Room. We'll talk again soon.